Hi, do you get aching pain that can be right inside the shoulder blade, down the back side of the arm, or even the front side into the forearm part of the thumb side, as well as some achiness over the front side of the chest wall? Well, this can be the scalenes. Hi, I'm Dr. Price, and I'm going to talk about trigger point release of the scalene muscles. Scalenes can be a culprit for pain that goes into the back side in the inside of that shoulder blade. So if you've been working all day long and you have achiness back there and you're not sure where it comes from, sometimes it does come from the muscles between the shoulder blade, but sometimes it is the scalenes. Scalenes are going to help you breathe in. So if you have not been breathing through the diaphragm and you're taking shallow breaths, these muscles overwork. And when you overwork a muscle or contract it repetitively, sometimes you can develop areas of tension and trigger points. So you can go in and release the trigger points. It takes about 15 to 20 seconds. And you can also work on the fascia. So I like to work on the muscle and fascia for about 2 minutes so that I can get an effective release and reduce the tension and trigger points in that muscle group. So we've got the anterior, middle, and posterior scalenes. The anterior and middle scalenes, they go from the transverse processes down into the first rib, and the posterior scalenes go from the transverse processes into the second rib. Now, transverse processes, that's going to be of the neck. If you go on the back side at the bottom of your skull, if you drop right down, that first bony prominence that pokes out is going to be your second cervical vertebrae. So the transverse processes are on the side. And then if you go down to the bottom of the neck, there's another bony prominence that pokes out. That's going to be your C7. So the scalenes are going to go from C2 through C7, and they're going to attach there and then into the first and second rib, anterior middle attached to the first rib, and the posterior attached to the second rib. So to find those, I'm going to take my fingertips and I'm going to go right behind the collarbone and drop down. And I want to do this gently because there can be a lot of tenderness in this region. If I'm close to the sternum, the chest area, I'm going to be on my anterior scalenes. And I just want to gently sink down into that tissue. If I feel pain, refer anywhere in those areas that I talked about, inside the shoulder blade, down the front of the arm, back side of the arm, or into the thumb area. That's going to be a trigger point. You want to hold 15 to 20 seconds and have that reduce and subside. And you can continue to hold to reduce the tension in the fascia. If I want to do a stretch while I apply pressure, I can further do that. And to stretch the scalenes, I'm going to look up and away, and you'll feel that stretch as you're applying pressure. And then I can come back to center. I'm going to work my way down out towards the shoulder. So I'm then working towards the middle scalenes and into the posterior scalenes. And again, I'm going to apply pressure, look up and away, and then I'm going to go to the posterior scalenes that are attached to the second rib, apply pressure, and again, look up and away. Work on this muscle for 2 minutes, and it can be super helpful to alleviate some of that achiness that you may feel between the shoulder blade, front side, back side of the shoulder, or even down into the forearm. So this can be a hidden culprit to those areas that can be painful at the end of your day with overcontraction, or if you have had lots of breathing that's been shallow. So I hope this is of help, and have a blessed day.